എൻ്റെ പേര് ബിന്ദു സുരേന്ദ്രകുമാർ എന്നാണ്. എൻ്റെ മാരേജ് കഴിഞ്ഞത് 2007 മാരേജ് കഴിഞ്ഞ് 3 കൊല്ലത്തിന് ശേഷമാണ് ട്രീറ്റ്മെൻറ്റിനായിട്ട് പോയത് ഹോസ്പിറ്റലിൽ. 2-3 ഹോസ്പിറ്റലിലൊക്കെ പോയിരുന്നു. അപ്പോൾ ഓവുലേഷൻ്റെ ചെറിയ പ്രോബ്ലം ഉണ്ട്, തൈറോയിഡിൻ്റെ ഉണ്ട്. അപ്പോൾ പല ഹോസ്പിറ്റലിലും പോയിട്ട് അതിന് വലിയ റിസൾട്ടൊന്നും കണ്ടില്ല. അപ്പോൾ എൻ്റെ ഒരു റിലേറ്റീവ് പറഞ്ഞിട്ടാണ് ഞാൻ ഇങ്ങനെ CRCയിൽ വന്നത്. വന്നു കഴിഞ്ഞ് ഡോക്ടർ ടെസ്റ്റൊക്കെ ചെയ്ത് കഴിഞ്ഞപ്പോൾ തൈറോയിഡൊക്കെ നോർമലായി. പിന്നെ അധികം കഴിയാണ്ട് തന്നെ പ്രഗ്നൻ്റ് ആവുകയും ചെയ്തു. 2-3 പ്രഗ്നൻസി അത് അബോർഷനായി പോയി. അത് കഴിഞ്ഞ് പിന്നെ 3ാമത്തെ ഇതായപ്പോൾ അത് നോർമലായിട്ട് വന്നു. ആദ്യത്തെ കുട്ടി 2011 ഉണ്ടായത്, ആൺകുട്ടി. അത് കഴിഞ്ഞ് വീണ്ടും 2 കൊല്ലത്തിന് ശേഷം ഇവിടുത്തെ ട്രീറ്റ്മെൻറ്റ് തന്നെ കണ്ടിന്യൂ ചെയ്തിരുന്നു. പിന്നെയും പ്രഗ്നൻ്റായി, ഒരാൺകുട്ടി തന്നെ ഉണ്ടായി 2013. പിന്നെ ഇവിടുത്തെ സേവനവും ഡോക്ടർ പേഷ്യൻറ്റിനോടുള്ള പെരുമാറ്റവും എല്ലാം അതുകൊണ്ടാണ് ഞങ്ങളിവിടെ വീണ്ടും കണ്ടിന്യൂ ചെയ്യാനായിട്ട് തീരുമാനിച്ചത്.
Bindu came to me first with recurrent abortion and secondary infertility around 10 years back. After evaluation of health issues and correcting nutritional and hormonal irregularities, including hypothyroidism and tubal block clearing, she was able to conceive within a few months. Progesterone and HCG support given for 3 months. Low molecular weight heparin was not given as it was tried in previous hospital during her last pregnancy and was not useful. Till 4 months, everything was going fine and referred the patient to a local hospital for further antenatal checkup and delivery. Unfortunately, fetal heartbeat stopped in the 4th month and medical termination of pregnancy was done. They came back for treatment again after the 5th abortion. We did an endometrial biopsy and sent the specimen for histopathology and tuberculosis PCR test. PCR test was positive for tuberculosis and histopathology showed evidence of infection. Treatment was given for tuberculosis for 6 months and repeat endometrial biopsy and PCR test was done. It came out negative. Restarted fertility treatment and she conceived again, and this time she delivered a healthy male baby at term. After 2 years, they came to start treatment for having a second child. We succeeded and now they have 2 smart boys. 2 years back, she came for treatment with heavy uterine bleeding. With the medication, bleeding was controlled and periods regularized. But she was getting frequent attacks of palpitation, joint pain, tiredness, and allergy. Abdominal hernia due to weakness of abdominal muscles and protruding tummy was also a botheration for her. On evaluation, her major problem were a derailment in the immune system. She was suffering from autoimmune thyroiditis for more than 10 years, and her autoimmune antibody ATG and TPO and ESR was very high. Frequent attacks of joint pain, allergy, respiratory infection, and sneezing pointed towards further compromise in immunity. She was given counseling on cell activation and health optimization. Started cell activation in May 2018. Within 3 months, she was able to reduce her weight by 8 kg and her weight came down to ideal BMI. Abdominal muscle got strengthened and protruding tummy with the abdominal hernia was reduced to a great extent. Thyroid function stabilized on 75 micrograms of thyroxine. Palpitation, joint pain, and sneezing disappeared. But the autoimmune antibody level continued to be high. She was asked to maintain the weight around 20 BMI and continue to follow cell activation principles. Repeat blood test in March 2019 showed her antibody level and ESR came to normal and TSH level to low normal. ESR came down from 80 to 15 and anti-TG 91 to 41 and TPO more than 1300 to 72. Now we can gradually reduce the thyroid hormone supplement and the thyroid gland will recover fully so that she need not depend on hormone replacement. Throughout these 3 treatment years, first for infertility and later for lifestyle disease, she was following instruction correctly and I consider her as one of my best patients. It gives immense pleasure and satisfaction in treating her. She's an example for many suffering with autoimmune diseases. It can be cured with lifestyle correction with cell activation support. Currently, medical fraternity and common people consider lifestyle diseases like diabetes, cholesterol, allergies, and autoimmune diseases can be treated and controlled with medication, but we cannot have a cure. If the person is willing to correct lifestyle and follow cell activation principle, almost all the lifestyle diseases are curable, and this patient is an example. Protruding tummy due to weakness of abdominal muscles is very common among women after delivery. Current treatment concept for this surgical correction, but most of it will get corrected by reducing visceral fat and strengthening the abdominal muscles. So we can avoid surgical intervention and its associated risk and side effects.